Hi everybody, Cait here, one of our physical therapists at our East Norristown location, here to go over best recommendations for shoe wear, for sneakers, okay? A couple of things I want to preface before I get into some more official recommendations. Number one, if you are someone who is relatively young, healthy, regularly exercises, and you're sitting here listening to this video going, like, what shoes should I wear? I would strongly recommend don't be overthinking it, and don't be going into any sort of like stability shoe or shock absorbing shoe if you don't have any issues, right? If you have stuff going on, if you have recurrent injuries that are going on with your low back, hip, knees, ankle, foot, listen up after this. But if you don't have any significant issues with anything, make your foot work. As soon as you go into more of like a stability shoe, so a stable shoe, or something with like a lot of shock absorption, those ones with like, this has a decent sole, the ones with a big cushy sole, as soon as you go down that track, you're taking away your body's ability and need to be strong and stable and take shock absorption, right? Anytime you're adding external support to your body, you're diminishing the way that your body has to react, right? So if you don't have any major issues, get a neutral fitting shoe, one that's comfortable, one that you think looks cute, and go for it, right? And make your foot work. That would be my number one strong recommendation, okay? Do not be getting into any of the specifically fitted shoes if you don't have any issues with your foot, okay? With that being said, a lot of us do have issues with, recurrent low back pain, recurrent hip pain, IT band syndrome, hip bursitis, plantar fasciitis, etc., who need to look into something like this because now it's more of a chronic issue or a recurrent issue, okay? So in the case of a stability shoe, someone with more of a flatter foot, so if you are standing on both of your feet, right? And you look down, is there a little bit of space between the arch of your foot and the floor? Or is your arch all the way on the floor? If your arch is all the way on the floor, you have a bit of a flatter foot. And if you have pain issues with things going on in your leg, that may be a relevant component. And the purpose of wearing a stability shoe would be to help kind of keep your foot in more of a neutral position, keep your arch off of the ground, essentially. So a stability shoe would be a great thing for you to look into. Now, the way to determine if something is a generically stable shoe, if you want to figure this out on your own, there's three things to look at in a sneaker, okay? Number one, up and down, okay? Now, I'm not pushing too hard. If I really push on it, I can get this to fold in on itself. I'm just looking at a very gentle stress and seeing how much this moves. This is fair, in the middle somewhere. Not super rigid, and again, not folding in on itself with a gentle pressure. So I would probably give it about a B- in the case for stability in the midfoot region. Forefoot, midfoot, rear foot. If we move up to the forefoot, here and here, okay? And again, this is pretty gentle pressure, and it's moving. Again, it's not like completely rigid, and I can't like fold it in on itself with light pressure. So again, I would give this a mid-range, maybe B- scoring, okay? Rear foot, same thing, twisting it in and out. Now the rear foot here actually has some pretty decent stability. That's not moving too much. I give that more of a B+, A-, okay? So those three things very generically assess how stable a shoe is. So if you do want more of a stable shoe, you're looking for minimal movement in all of these planes, okay? Now, if you're one who suffers from more of a, maybe chronic heel pain or chronic plantar fasciitis, that's when you're looking for more of a shock absorption shoe. So these actually have a decent sole, decent cushion in the area where the heel would land, okay? So that's what you would be looking for, something with a little bit more shock absorption here. Same thing that goes for someone who's suffering from some more significant arthritis in your ankle, knee, hip, even the low back. You're also looking for something with a little bit of shock absorption, something that as you put your heel down on the ground is going, and it's going to take a bit of that shock instead of that force transferring up through the joints, and then that arthritis is going to be sort of aggravated by that. So that would be a good thing for you to do as well. The last thing that would respond well to more of a shock absorption shoe would be more of a supinated foot posture. So standing on both feet. And now what you're going to notice is I have a lot of weight on the outside of my foot. And when I look down, I have a pretty big arch in relation to, like, there's a decent amount of space between the arch of my foot and the floor. That's more of a supinated foot posture. In those instances, your foot is usually a little bit more rigid and doesn't do as good of a job as absorbing that shock and that force as you put your weight and of the foot through the ground. So more of a shock absorption shoe would be good for you as well. So that's my generic recommendation for shoe wear, okay? As with a lot of the things we talk about in here, there's a lot of variability that goes into my recommendations for my patients, all right? Everyone is different and everyone needs a specific evaluation for the particular thing that they're dealing with, right? So if you have any concern about this, if you have any questions, give us a call, okay? Otherwise, good luck.